As of right now, we don't really know why it affects women more so than men.
We often hear about the fight against cancer or the risks of heart disease. Now, more than ever, there's another battle neurologists are facing every day.
Alzheimer's disease is just exploding as an epidemic. As people are living longer, we're seeing more and more Alzheimer's every day.
Dr. Ronald Schwartz, neurologist and director of the Neurological Research Center at Hattiesburg Clinic, says 2/3 of Alzheimer's patients are women.
If you've got 5 million Americans with Alzheimer's disease, about 3 million would be women, and that's probably something people don't recognize.
Also consider the most significant risk factor, which affects everyone.
The biggest risk factor is just aging.
And he adds the memory loss that you get with aging is probably Alzheimer's more than just regular aging, meaning you can go on for years not knowing you have it.
The pathology which causes it begins to build up 15 to 20 years before you've got any symptoms at all.
You can see with the facts mounting that the work done here to battle Alzheimer's is imperative.
We were a clinical site for one of the trials where they developed the medication for this.
This medication is called Amyvid. Here at the center, they research and oversee clinical trials for Alzheimer's disease, among other disorders that affect the nervous system. Part of one trial was the collaboration of scans and Amyvid, an injectable tracer.
The scanner, you can see over my shoulder, the machine is called a PET scan.
Schwartz says for the past few years, the center was one of other clinical sites to work with the tracer. Dr. Schwartz's trials, along with other institutions, led to the FDA approving the tracer.
But there are 2 or 3 new tracers that are similar that the FDA has just approved within this last year, and there's some new tracers that are still in development also.
Together, the new injectable tracer and the PET scan work to diagnose a patient with Alzheimer's disease.
The new technology is the medicine or the tracer that we can inject into the person's body, circulates through your brain. It'll stick to the amyloid plaque, which is what we think is the initial cause of Alzheimer's. That's the cause which has been developing for 10, 15, 20 years before you get any symptoms at all.
The tracer allows Dr. Schwartz to see the plaque in the brain on the PET scans.
If it's positive, it means you've got that plaque accumulation. That's suggestive that your problem could be related to Alzheimer's.